Hi everyone, it's Dr. Charmaine Johnson from Premier Smile Center again. Today I actually want to talk a little bit about how does gum disease affect diabetes and how does diabetes affect gum disease. A lot of people don't realize the correlation between the two. And so I just want to kind of recap, just go over a bit of that a little bit. Essentially, so what is gum disease? So gum disease is anything from gingivitis to what we call periodontal disease and eventually bone loss and tooth loss. And how it forms is the bacteria in your mouth that's created, that you just naturally have in the mouth, eats and feeds on the plaque and the food debris that is left in the mouth after you eat and that you don't remove easily. And in that process, it also attacks your bones and gum. So the body, in response to that, as a defense mechanism, creates inflammatory cells and enzymes to try and attack and break down that bacteria. And at the same time, though, it breaks down its own gum tissue and its own bone. And this breakdown then causes inflammation of the tissue. It causes bone loss. And if when you've been to the dentist, you'll know that the dentist measures what we call your pocket. So essentially, if this is your tooth and this is your root surface, and my shirt is your gum tissue and my watch is your bone, we measure from the top of the gum to the level of the bone. And those numbers can range anywhere from 1 to 10, 11 millimeters, 1 being good. So 1 to 3 is a good measurement because that's kind of a natural pocket that's around your tooth. But anything above that with bleeding is an indication that you have either gingivitis or gum disease. And the higher the number, the more bone you've lost because the bone shrinks down. And so what happens then is that over time you lose more and more bone and the teeth become loose, or you have sensitivity and you have pain when you chew, and now the teeth have to be pulled out. So that's essentially what gum disease is. And diabetes, well, diabetes is actually controlling or inability to control the blood sugar level, and either you're taking insulin or you're taking some tablets to try and get that under control. So how does this work? Well, the bacteria in your mouth travels throughout the body through your bloodstream, and there's many studies that have shown that there's a correlation between heart disease and gum disease, preterm babies, now Alzheimer's, different types of cancers. And when it travels through the bloodstream, it locates itself and it finds itself in different organs. The pancreas is the one that controls the insulin in your body and affects whether you have diabetes or you don't. And when it enters the pancreas, it causes inflammation because it causes irritation of the tissue, and then it affects the control of the insulin. So what ends up happening now is I've noticed that patients will come in and they have uncontrolled diabetes, but at the same time they have severe gum disease. And once we get that gum disease under control, miraculously the diabetes is much easier to control. Now, it doesn't mean that it gets rid of it, because sometimes it's so far advanced you've got to do a lot of other things with medicines to get that under control, but it makes it so much easier to control the diabetes. On the other end, on the flip side of it, we've had patients who can control their gum disease, control their diabetes, and they come in afterwards and it's easier to maintain gum health. And the reason for this is that when you have diabetes, you actually have a decreased blood flow to the bone and the gums. And it makes it harder in terms of dental procedures. So when you have an extraction, the healing in an extraction is not as good if you have uncontrolled diabetes. So from both ends of the spectrum, it's important to keep them under control. And we can help you with that, but basically it's making sure you maintain your gum health very well with basic oral hygiene techniques at home. It is making sure that you go for regular dental checkups and cleanings so that we can help you keep that under control. And then if you have gum disease, the bad thing about it is, you've got to fix it. And so how do you fix it? There's deep cleanings, there's a laser now that we can use to help to get that under control. It actually kills the bacteria in those pockets. It helps to remove that diseased lining to allow it to reattach to your tooth, and through this process it releases stem cells into the pocket so that those stem cells can help to regenerate bone. So there's actually a laser that's FDA approved for that, and we can help you with that if that's your scenario. So feel free to give us a call at 954-566-7479, 954-566-7479 if you have any questions, and I'm more than happy to help you with that. Keep safe and keep healthy.